Medic 1 to headquarters.
Go ahead, Medic 1.
We're on the scene with a 6-year-old white male who was struck by a moving car approximately 30 miles per hour while riding his bike.
Administer another 600 cc's of lactated ringers by intravenous bolus and continue life support. We'll meet you at the door.
Medic 1 copy.
Children's clear. Call trauma stat.
Emergency room.
Sandra. Julia, I'm going to the code room. You guys can hold rooms 2 or 3.
Richard, did you know your mother was here? Yeah, Mommy's here. She's sitting right up front.
Richard, Mommy's here.
A child suffering from multiple injuries presents a unique challenge to the hospital trauma team.
You'll be okay. Mommy will stay right with you.
Most hospitals have adequate staff to deal with pediatric trauma successfully. The key is to develop a predetermined treatment protocol. As surgical coordinator, I lead a team of pre-assigned personnel dedicated to treating the unique needs of the injured child. The needs of a child differ physiologically, pharmacologically, and emotionally from the needs of an adult. Our program presents a model of hospital team roles for the treatment of pediatric trauma. If necessary, you can adapt these roles to the varying resources of your facility. The hospital pediatric trauma team is divided into 2 groups. An inner core team, which is directly responsible for the child's emergency resuscitation and stabilization, and an outer core team, which provides administrative, logistical, and lab support outside the resuscitation bay. I'll explain the role of each trauma team member, beginning with the inner core team. The inner core team includes 9 people, each with a predetermined set of tasks. The team is positioned around the child. As surgical coordinator, I act as team leader. An anesthesiologist and respiratory therapist are at the child's head. On the child's right is a surgical team, consisting of a surgical resident right and nurse right. On the left is a medical team, with a medical resident left and nurse left. Other regular team members include the medication nurse and the nurse in charge. The surgical coordinator may also call in the ER attending and an OR nurse. The inner core team performs life support procedures simultaneously in ABCDE priority: airway, breathing, circulation, disability, and exposure. Because many procedures occur simultaneously, we'll be repeating the trauma event to emphasize each person's role and responsibilities, so some actions may appear out of sequence. As surgical coordinator, I'm responsible for the overall resuscitation effort. I direct the team's actions throughout the trauma event.
Breath sounds are really down on the right, and his trachea is shifted a little to the left. Let's put a chest tube in right away. Let's get it in.
This responsibility requires a senior surgical resident or attending. I receive information from my other team members and continually assess the child's condition, deciding the course of therapy in ABCDE priority. At the child's head, the anesthesiologist and respiratory therapist work as a team. The anesthesiologist is responsible for the child's airway and breathing.
Richard, let me put this arm down.
He also protects the child's cervical spine. Other tasks include auscultating heart and breath sounds and checking pupils to monitor the central nervous system.
Terrific.
The respiratory therapist, working with the anesthesiologist, keeps the child's head and neck immobile, assists with airway procedures, and ensures that all children receive 100% oxygen. After stabilization, she may take over airway management and assist the transport team. On the child's right, the surgical resident and nurse right work as a surgical team.
Got a big gush of air in this thoracentesis. Okay, let's get the tube in.
Surgical resident Wright is a senior-level resident. During life support, he gains IV access.
All right, we have a good 18-gauge catheter in. Okay, secure it in, push some blood in over on that side.
And manages fluid resuscitation on the child's right side. He also performs emergency surgical procedures and achieves hemostasis by external pressure. During cardiac arrest, the surgical resident assesses and treats the mechanical reasons for the arrest, checks femoral pulses, and reviews airway, breathing, and circulation. Nurse Wright is normally assigned to the neonatal intensive care unit. If a child is suffering from burns, she's replaced by a burn unit nurse. Nurse Wright is familiar with complex ICU equipment, complicated IV lines, and emergency surgical procedures. During life support, she assists surgical resident Wright. She monitors and controls right-side infusions, announcing fluid inputs and outputs to the nurse in charge. She also places the ECG leads, operates the trauma table, and monitors the child for exposure. On the child's left side, the medical resident and nurse left work as a medical team. The medical resident left is a pediatric intensive care specialist. She draws blood samples, arterial gases, and obtains left side IV access. She also achieves hemostasis with direct pressure and monitors the child's pulse. If there's no pulse, she initiates CPR procedures. At my discretion, she calls for and administers medications and coordinates the defibrillator.
Richard, you're in the hospital. You're at Children's Hospital, and you've been hit by a car.
Nurse left is an experienced emergency room nurse. Besides assisting medical resident left, one of her key tasks is to talk to the child, explaining procedures. So she must possess good patient communication skills. During life support, she cuts off the child's clothing and obtains and announces vital signs every 5 minutes. She also monitors and controls left side infusions.
We got a second line in, Nancy. We have ringers being pushed.
She announces fluid inputs and outputs to the nurse in charge. In case of cardiac arrest, nurse left performs chest compressions. The medication nurse and nurse in charge interact with all the other inner core team members. The medication nurse is from the pediatric ICU. She is thoroughly familiar with pediatric dosages, drug actions, incompatibilities, and dilutions. Before the child arrives, she assembles and labels blood drawing equipment and prepares saline flushes for IV and Foley procedures. During life support and cardiac arrest, she prepares all medications and infusions, announces dosages to medical resident left, and assembles pressure lines and transducers.
Do you have that blood gas ready?
The nurse in charge is also an experienced emergency room nurse. During resuscitation, she records the trauma event, monitors nursing activity, and keeps the team updated on the child's vital signs, medication times, and fluid infusions.
Let's get them ready to go up to the CAT scanner. It's like everything's
She anticipates needs for equipment and supplies and places requests through the nursing administrator liaison. Now, the nursing administrator liaison will explain the roles of the outer core team during the resuscitation.
The outer core team stands by to provide administrative, logistical, and lab support. This team consists of 8 people: the ER attending, the nurse administrator liaison, the OR nurse, a social worker, an X-ray technician, a lab tech, a central supply tech, and a security guard.
So you can assure her she will know everything that's going on.
As the nursing administrator liaison, I'm familiar with all available resources.
No problem. Could you call the orthopod? I'm going to go talk with the mother right now.
I serve as the communications link between the inner core team and the rest of the hospital.
Dr. McGlynn, please.
I obtain supplies, equipment, and specialty consults, coordinate the child's nursing needs during and after resuscitation, and assign transport nurses from the inner core team.
Do anything.
We're ready for X-ray.
I also control staff access to the resuscitation bay, handle documentation, and answer any inquiries about the child's
Still
condition.
waiting for the CBC.
Okay.
Julia, I'm going to the code room. You guys can hold rooms 2 or 3. Let Layla know that I'm going, all right?
An OR nurse responds to all trauma alerts. Her presence provides the inner core team with immediate support when a child requires major operative procedures. She also prepares an operating suite for surgery after stabilization.
Laboratory, please. Okay, let me check things out here.
The lab technician verifies blood samples and takes them to the lab.
Thank you.
She remains with the samples to expedite their analysis and to ensure that I receive a prompt phone report.
Trauma staff, the emergency room. I have blood gases for you.
The central supply technician remains outside the resuscitation bay, ready to obtain extra supplies and equipment.
Here's a sample from the resuscitation bay.
When family members arrive at the hospital, a social worker is their first contact, acting as hospital representative and providing immediate reassurance.
He expects me to...
Let's get him in here.
The family should be guided to a quiet space, away from the traumatic sounds of the emergency room. There, a social worker reviews the resuscitation process underway for their child and obtains a brief accident report and medical history. The social work staff stays with the family, providing continuous emotional support and updates on the child's status. The social worker arranges a visit with the child as soon as his condition permits, and continues to support the family throughout the child's stay in the hospital. The ER attending moves in and out of the code room as needed, remaining in the area as a backup medical resource.
So it seems that he's improved
It seems
quite a
that
bit from
his
the
condition
He
is...
debriefs field care providers and relays the information to the surgical coordinator.
She's very concerned. Incidentally, she did mention that he seems to bruise pretty easily.
Any family history of any problems?
No, I asked.
And how about when he had his appendix out? Any bleeding problems?
He did okay with his appendix out, no problem.
At intervals, he joins the social worker to reassure the family and provide updates on the child's condition.
Would you give this to Richard, please?
Sure.
Thank you.
The outer core team also includes a security guard. He monitors the ambulance entrance and resuscitation bay and expedites transport to the receiving unit.
You're ready for X-ray. Thank you.
Until the transition phase, the X-ray technician remains outside the resuscitation bay. On my cue, he enters the bay and performs a radiologic exam with assistance from surgical resident Wright. The X-ray tech will immediately process and return the films to the resuscitation bay.
By the transition phase, the inner core team has stabilized the child's immediate life-threatening injuries.
I am starting to feel a little resistance.
All right.
Now the team works together to perform post-stabilization procedures. Surgical resident Wright performs a rectal exam and ensures that the child receives an indwelling bladder catheter and nasogastric tube.
This right thigh is really pretty swollen. I'm pretty certain he's got a fracture here.
While I conduct a head-to-toe exam, medical resident left reevaluates the child's airway, breathing, and circulation.
Blood pressure doing?
I think I can go ahead and get the operating room ready, and I think it's probably time for me to turn this on over to Mel, if you're comfortable with that. Let me just hand it off here, and I'll go right on to the OR. You're doing just fine, Richard.
I asked the nursing administrator liaison to arrange specialty consults, then go and meet with the family members.
Okay? Get the CAT scan.
I meet with the specialty consults in the resuscitation bay.
This is a closed fracture, so I don't think...
We discuss if the child should go to radiology, the OR, or the ICU. Throughout this phase, the nursing team has readied the child for transport and completed documentation. The nursing administrator liaison alerts the receiving unit.
The nurse told me that he's stable, and she wouldn't say that unless she meant it.
Okay.
And the social worker stays with the family, providing continued assistance, emotional support, and information. During the transport phase, the inner core team retains responsibility over the child. The surgical resident Wright monitors the patient's stability.
In the CAT scan area, don't you?
Yes, we have one set up and ready to go.
The respiratory therapist continues airway management.
Listen, Richard, we're on our way to that special X-ray.
Nurse left assists with care, continues talking to the child, and records actions during transport. A trauma protocol provides a framework for coordination between the trauma team and the total resources of the hospital.
Okay, we're on our way.
Defining roles enables the trauma team to meet the unique needs of the injured child. By using the team concept, we can make a significant impact on the nation's leading killer of children, trauma. You can obtain more information on child trauma through 2 other videos in this series. Pediatric Trauma, Procedures for Emergency Resuscitation, presents the treatment protocol followed by the trauma team. The video highlights equipment, medications, and procedures, which differ significantly in the treatment of pediatric trauma in the emergency room. The other videotape in this series, Pediatric Trauma Pre-Hospital Emergency Care, outlines a field treatment protocol to be used by paramedics and emergency medical technicians. The program presents child-specific procedures, equipment, and medications required at the accident site and during transport to meet the unique needs of the seriously injured child.